Robby, what is on your radar?
Dr. Anthony Fauci, a Grinch if ever there was one, is not sure whether Christmas might have to be canceled yet again this year. On Sunday, the White House's top coronavirus advisor told CBS's Margaret Brennan that it was, quote, too soon to tell whether Americans will receive the public health bureaucracy's permission to celebrate the holidays with friends and family members. Let's watch.
We can gather for Christmas, or it's just too soon to tell?
You know, Margaret, it's just too soon to tell. We've just got to concentrating on continuing to get those numbers down and not try to jump ahead by weeks or months and say what we're going to do at a particular time. Let's focus like a laser on continuing to get those cases down.
I have another question for Dr. Fauci. What planet are you living on? Most people are having social gatherings right now. The idea that they won't celebrate Christmas is a ludicrous fantasy peddled by someone who either doesn't understand human nature or is being obtuse about it. People want to celebrate Christmas. They were patient with the public health establishment last year, and there's every reason to believe that things will be better this year, no matter what Fauci has to say about it. In fact, many modelers now believe that we have surpassed the peak of the Delta variant's wave, and they expect that COVID-19 cases will fall precipitously in the coming weeks and months, thank God. That's great news. Widespread vaccination is working to counter Delta's increased transmissibility, while significantly decreasing severe disease and death. But even if cases remain higher in the winter months than we're hoping for, it's simply not realistic to expect Americans to skip Christmas parties for another year in a row. Indeed, except for pockets of extreme restrictions and compliance, elite college campuses, for instance, and more on that in a minute, many, if not most Americans, have already gone back to something resembling normal life. People are socially gathering, attending sports games and concerts, and traveling for leisure. Some individuals practice greater caution than others. The number of presumably vaccinated outdoor mask wearers in Washington, D.C. is fairly high. But the country has opened up again. Parties are taking place right now, and it's not exactly a secret. America's social elites are practically flaunting their pandemic is over status. Remember the Met Gala, the Emmy Awards? Of course, there's one group that is stubbornly scared of doing normal things: epidemiologists. Throughout the pandemic, infectious disease experts have urged their fellow Americans to avoid virtually all social contact. Surveys of epidemiologists routinely reveal that they are afraid of many normal activities, even post-vaccination. As recently as May, most of them said they would have refused a hug. According to a recent informal poll of 27 health experts, they are still incredibly wary. Of the 27 who were surveyed, all of whom presumably are vaccinated, 22 said they would refuse to see a movie, and 18 would decline to eat indoors at a restaurant. More than half would skip a wedding. The experts can exercise whatever level of caution they deem appropriate for themselves, and if Fauci would like to spend Christmas by himself, that is his right, but we should not allow the most risk-averse government health bureaucrats to set the standards for everyone else. The vaccinated have done everything that was asked of them and are incredibly protected from negative COVID-19 health outcomes. The idea that it's an open question whether we will be celebrating Christmas this year is laughable. I'm a libertarian, and I'll openly admit that for as long as I've had strong political views, I've been skeptical of coercive government power, of the idea that a centralized bureaucracy is qualified to tell me how to live my life. But if anything, the pandemic has only made me more suspicious of the class of power brokers calling themselves the experts. It seems that wherever elite opinion holds sway, we are witnessing terrifying tyranny with respect to the pandemic. Earlier, I mentioned college campuses. In theory, elite Ivy League campuses are among the safest places in existence, including from COVID-19. Campus environments where the populace skews younger and the vaccination rate is 90+%, they're ideal places to ease into post-pandemic reality. They're extremely safe from the threats of mass death in crowded hospitals. University authorities would be well advised to treat the diminishing threat of COVID-19 as an opportunity to lift restrictions, ease up on masking, and let students enjoy the social and educational experiences that they're paying for. Instead, something close to the opposite is happening. Far from returning to normal at an accelerated rate, many colleges are implementing some of the most brutally authoritarian mitigation efforts out of anywhere in the country. Harvard encouraged students to keep close contacts to a minimum and wear masks at all times. Yale instructed students to wear masks in their own dorm rooms if any friends are visiting. The University of Southern California prohibited all indoor eating and drinking and asserted that if students needed to hydrate during class, they should first leave the building. In an effort to completely disrupt illicit socializing, Columbia reprogrammed key cards so that they would only grant access to students' individual residence halls. Oberlin College is prepared to implement the most ridiculous COVID-19 mitigation policy of all, a near universal masking requirement in all indoor and outdoor spaces. Oberlin must be experiencing a fairly severe outbreak to merit such measures, right? Well, actually, the campus has reported just one case since the semester began, and only 12 cases in the previous spring semester. I mention these examples because all normal people should fear the tyranny of the experts, of the Ivy League educated health czars who think they know better than you how you should run your life. Dr. Fauci and his cohorts have decided there's basically no level of acceptable risk, and we should shelter in place until we have COVID-0, which, by the way, might never happen. And we might all go crazy from isolation and loneliness if Fauci gets his way and we wait for it. Instead, take reasonable precautions, including by getting vaccinated, particularly if you're in an at-risk group, elderly, or immunocompromised. And feel free to enjoy the holidays no matter what the public health bureaucracy thinks. So I know I talk about this on the show a lot. It's just, it's genuinely worrisome. And I bring up the campus things not because I'm obsessed with college campuses, but as I'm often accused of being. But we've seen how the culture, the cultural values of elite college students comes to like dominate every other aspect of society. So I'm really worried that the class of people who are most safe from the pandemic will soon be running all of our lives and saying like, well, yeah, you have to wear a mask outside. Put the mask back on between sips of Gatorade or something. Am I crazy? This worries me. It does.
I mean, we have seen, yes, Oberlin style values creep out of Oberlin and into office spaces, and not just kind of progressive spaces, but corporate and basically any institution that becomes populated with people that emerge from those elite institutions. So it turns out that yes, what values are inculcated in those institutions does actually matter.
Yeah, and it's just, there's no way it's the case that, so if Dr. Fauci said you should not have Christmas this year, I almost no one is going to listen to that. The only people who are actually going to cancel Christmas are the people who are
celebrate it
totally
to begin with.
don't celebrate it to begin with, right? Are totally vaccinated, are have high degrees of compliance with social health measures. The people who are most at risk of having some negative COVID health outcome because of excessive Christmas partying are like, they're not listening to what he says, so it doesn't matter. He doesn't. I don't think he knows his audience anymore. He doesn't. I wonder how much he grasps that he's lost, kind of like, or that he's become part of the tribal conversation, right? That he's Team Blue and Team Red does not do what Team Blue wants, and vice versa.
It would be more interesting if public health officials would have more open conversations with people that would say, look, if you're not vaccinated, we would strongly advise against any indoor holiday gatherings. If you are vaccinated and plan to have a gathering, what are the best ways that you can make sure that it goes off as safely as possible? We talk to our experts. Here's what we say, and list out the different things that people can do in kind of descending order of annoyance. And people, I think, would appreciate then having kind of a menu of options that they could pull from and say, oh, so test 2 days ahead. Right. Keep a window open near the turkey. Whatever the public health officials are suggesting to be while they acknowledge that people are going to do this. Because if you just pretend that people aren't going to do it, then you're back in like a war on drugs type of situation.
Right. And by the way, I don't even think they're hypocrites, because when you survey these people, they routinely say that, I don't plan to have like lunch with a friend inside until like the next century.
Right. No, they're living their values, a lot of them, for sure.
They are living their values.
But also, case counts are coming down, so we could be in a better place come Thanksgiving.
Right, I think we will be. We have to beware of the seasonality of the virus, and it could be the case that everywhere, so this is what we saw last summer, everywhere suffering a kind of severe, the warmer states, because people are actually inside. It's so hot in those states, people are spending more time inside, where the disease is more likely to spread. They'll have more mild temperatures. People will actually be outside. This is exactly what we saw last year. Then those places were doing better, and then it was the Northeast having a bigger problem. So I'm hoping we don't see that.
And pre-vaccines, we did see around the holiday, and probably because of the holidays, Thanksgiving and Christmas, Hanukkah, and people getting together, you saw massive spikes come around. And you saw thousands of people that died as a result of that, and that's just a brutal way to go.
Oh, yeah. Fingers crossed we're going to have a better better winter season this year. Coming up, Team Rising discusses Trump's legal plea to get back on Twitter. Stick with us for that.